Rest reading is being. Okay, next we are learning the knee joint. Okay, so the knee joint between the femur is one of the complex joints in the body, reinforced by multiple ligaments and some other structures between the femur, tibia, and fibula. So the articular capsule is thin and it's not continuous for the knee joint. Basically, what you are looking at on surface is articular capsule, but the knee joint, although it lacks a continuous and thick articular or dense articular capsule, is rather thin, is reinforced by number of other structures. So in the knee joint, we see the following structures. We see two collateral ligaments extending between the bones. One is tibial, the other one is fibular. Then we see two menisci, individual meniscus. Menisci or meniscus. Basically, these are fibrocartilage pads. Used for shock absorption and proper articulation between the femur and the tibia. Then we also have cruciate ligaments, two cruciate ligaments. One is anterior, other one is posterior. So two cruciate ligaments, and these names anterior, posterior, these names are given based on where they are emerging from, where they are starting from. Okay, if they're starting anteriorly, then it's anterior cruciate. If it's starting posteriorly, it's posterior cruciate ligament. So basically the origin of the ligaments. Okay. So let's take a look at those. First thing, identify the tibia. Tibia, you can see the tibial tuberosity. This is an anterior view, anterior aspect. How do I know it's the anterior aspect? Of course, we can see the tibial tuberosity. Okay. So here, between the femur, this is the fibula, this is the tibia. Between the femur and the fibula, this is the fibular collateral ligament. Okay. Since fibula is on the lateral side, this is the right knee joint. Sometimes it's also referred to as lateral collateral ligament. So it's better if you refer to this as the fibular collateral ligament. Okay. Tibial collateral is not visible here because of the angle of the rotation, the aspect that you are looking at. We are looking at the much of the lateral aspect. So the two menisci, individual meniscus, the lateral and the medial meniscus. Okay. So the lateral medial meniscus comes from, again, of course, their positioning, which one is lateral, which one is toward the medial. So this is the lateral meniscus. Here is the medial meniscus. Make sure you have that reference toward the fibula is lateral. The other side is the medial. So medial meniscus, lateral meniscus. And we can see the cruciate ligaments too. Here we can see the coming off from anterior aspect. Originating from anterior is the anterior cruciate ligament. And you can also see the posterior coming from posteriorly. You can see the posterior cruciate ligament. So this is again, basically this is the right knee, anterior aspect of the right knee. And you can see most of the structures we are learning. You can see the fibular ligament, you can see the lateral meniscus, the medial meniscus, you can see the ACL, anterior cruciate ligament, and you can see the posterior cruciate ligament as well. This is the posterior view. Still the right knee. We are looking at the posterior aspect. As you can see here, fibular, we already learned this. Fibular collateral ligament. Here is this tibial collateral ligament, medial meniscus, lateral meniscus, we can see the posterior cruciate ligament originating based on the origin, and you can see the anterior cruciate ligament as well. So basically we can see all the structures that we are studying right from the posterior view. Okay. You can also use this image. You can see all of them. It's the same thing minus the cartilage, without the cartilage. So basically, we are not looking at the hyaline cartilage that you can see here. Hyaline cartilage is basically present between the bones. Here, between femur, tibia, you see the hyaline cartilage. Here, the same joint, you are just not able to see the hyaline cartilage. This is devoid of the hyaline cartilage. So as you can see, tibial collateral ligament, fibular collateral ligament, posterior cruciate ligament, anterior cruciate ligament, medial meniscus, lateral meniscus. That completes our study of the joints or arthroses.